My name is Eric Beidel, and I am the president of the Central Pennsylvania Health Underwriters Association.
Beidel says the Affordable Care Act calls for some changes to health insurance coverage starting in 2014.
Pretty much everyone's required to have health coverage. There are a few ways you can dodge it or get out of it, but pretty much everybody is.
People who can afford coverage and don't sign up for it will pay a fine that's set to increase as time goes on.
What is new and what will be different is how you get coverage. Let's say you're an individual that has coverage now through your employer, and you want to know what's going to change in 2014. Well, if your employer continues to offer coverage and it meets all of these new guidelines as far as what it costs you as an employee to be enrolled in it, also what it covers, as long as it meets all the requirements, that's pretty much your only choice. And basically, your cost has to be less than 9.5% of your income.
Large employers that don't offer sufficient coverage will be subject to fines.
When we look at employers that have less than 50 employees, there is no fine or penalty for them to discontinue offering coverage. That's going to be the big test. Which of those employers are going to continue to offer coverage, which ones aren't. Now, if you're in a situation where your employer decides, I'm not going to offer coverage anymore, or you're uninsured now, then you can go through the exchange. The idea of an exchange is to make one central place where you can get information on healthcare coverage. Policies that are offered through the exchange, the one difference with those is an individual, if they're eligible, can get a tax subsidy to help pay for that coverage, and that will only be available with one policies that are offered through the exchange. If you're below 400% of the poverty level, then you can get a tax subsidy. It may mean they wind up in Medicaid. It may mean they wind up in an exchanging policy and get help paying for it there, but those will be the avenues that they can take in order to find coverage. It's still hard to say how much things are going to change. It really depends a lot on what coverage you get now and how you get it, and first and foremost, what your employer decides to do.